your effect. You should avoid bad accident. If you are taking verapamil, needing existing clarification, clarification, itraconazole, ketoconazole. This medication might increase your bad effect. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter. When you taking Adaxa, some over the counter like Motrin or aspirin might increase risk of bleeding when you take with Adaxa. So make sure you let your doctor know when you are taking Adaxa. You should avoid Adaxa if you have major and ongoing bleeding with Adaxa. You should not use Adaxa for blood clots due to cancer. Typically, for people who have blood clot related to active cancer, they should take warfarin or Lovenox instead. You should check with your doctor who manage your blood or the anticoagulation clinic for further instruction. Please, if you have any in the comment box. Thank you. Avoid erythroid or riboxaban if you are allergic to erythroid. You should not use erythroid for some indication such as anti-phospholipid antibody syndrome, mechanical heart failure. You should avoid erythroid if you are taking rifampin, carbamazepine, phenidine. This medication may reduce your Yeroto effect. You should avoid Yeroto, ketoconazole, isoconazole, ritonavir, because this medication might increase effect. You should check pharmacist or your doctor for any other medication to make sure there is no drug interactions between Yeroto and prescribed medication or over the counter, such as Utrin or aspirin. To avoid Yeroto, if you are having major ongoing bleeding with Yeroto, you should not use Yeroto if you have blood clots due to active cancer. Please check for your general. You should check with your doctor or your pharmacist for question. Please let me know if you have it in the comment. Thank you. Avoid Eliquis or Abiciban. If you are allergic to Eliquis, use Eliquis for indications such as for indication with antibody or anticoagulation. You should not take Eliquis if you are taking rifampin, phenytoin, because these medications, the Eliquis effect. For Eliquis, if you are taking ritonavir, because this medication might increase the Eliquis. If you have to take ketoconazole, isoconazole, or ritonavir, you may reduce Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or diclofenac instead. This is just for your general information. You should check with your doctor who manages blood thinner medication, your anticoagulant. If you have any question, please let me know in the comment box below. Thank you. Addition means have the same the opioid give you. Opioid effect give you a good feeling. So to continue feeling. Heroin is an opioid such as cocaine, other non-opioid drugs such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. prescription opioids, oxycontin or oxycodone. Methamphetamine is non-opioid stimulant. A lot of using heroin after hard time to get the oxycontin due to the oxy issue to the manufacturer who do pharma. People will die because the oxycontin relieves effects overdose. The had to file a bankruptcy, and now it has no pharma. So when the oxycontin supply has problems, the drug cartels take some advantage about that. The illegal drug people who have the oxycontin abuse addiction, they are looking for a alternate drugs. They are using heroin. They are start using heroin because drug is cheaper but for stronger effects. Dependence or addiction can be psychological. People who have heroin addiction or dependence can be overdose because same fueling. In order to get the same fueling, they need to continue to use this drug. When they don't have money to buy the drug, they will come. You should seek a medical treatment if you think you have opioid dependence addiction. No, addiction is a hard topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids, including heroin, non-opioid drugs such as marijuana, methadone. Marijuana may be legal, and the prescription opioids, including oxycontin or oxycodone, fentanyl, a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is the prescription opioids, including oxycontin, fentanyl, due to a severe pain. How it works? Fentanyl pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is not a disease. Arthritis is a disease. Pain symptom. You may have a severe surgery or a major surgery. You should use non-opioid medication. No modern research for an low dose opioid as possible to avoid major addiction from overdose of the opioid. Fentanyl manufactured a lot nowadays from China, and then the United States, the Mexico border. People who have the heroin or oxygen or, or dependence, they start using the fentanyl. Right? Maybe more convenient and it might be cheaper or stronger effects. Supply had some issue because they are ongoing is manufactured. Purdue Pharma had to file a bankruptcy dose for the fentanyl 25 to 1 microgram per ounce. Fentanyl 25 to 100 microgram per ounce equal to OxyContin 10 every 12 hours. Fentanyl 50 times more potent than heroin and 100 times more potent than morphine per DEA. But DEA, the lethal dose, is about 2 milligrams or 2,000 micrograms from these illegal micrograms found more than 2 milligrams. So one tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet or pill. The fentanyl dependent addictions can be physical or psychic. Addiction means you want to have the same feeling the opioid give you. Effect, you good feeling like high, so you having that it means addiction. See, you get overdose because you want to feel better. That feeling, that better. So you want to have. So it's easy to get. When people get overdose, they get addiction or dependence crimes due to drug dependence, drug addiction themselves because of psychological issues. People have addiction or dependence to fentanyl really need medical. Should seek a within you have drug or opioid dependence or addiction. Can be very. If you have any further question, please let me know in the comment box below. Content addiction. OxyContin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methadone, marijuana for medical treatment in some states. Some prescription opioids in OxyContin or fentanyl, hydrocodone, codeine, morphine, and non-opioid methamphetamine stimulant. What content oxycodone is extended release, so it can last for 12 hours. It's used to treat a severe pain. Yeah, OxyContin pain by binding to the receptors on nerve cells. So what is pain? The pain is just a symptom. It's not a disease. A disease maybe an arthritis. For example, arthritis is a disease that may cause such as pain. You may have a severe pain after a surgery or surgery. You should use medication. Tylenol, Motrin, research, Soma, and opioid. Or you should use low dose opioid as possible to avoid major addiction from a high dose overdose of the abuse be from the doctors. Inappropriate manufacturers maybe for drug abuse to manage their distribution appropriately. The opioid addiction and dependence can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect for the oxygen. If they give you a good feeling like high, so you continue having that feeling. It means addiction. It is overdose because you want to feel better and better with that feeling. At least the same or better feeling. So it's easy to get over. When people get overdose, they can be that addiction may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence to monitor increase the drug addiction. Some states have monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing oxytic content addiction, you should take oxytocin and is indicated, such as for after a surgery. You should stop medication as instructed by your doctor. You might check to make sure you have this side effect. You may use opioid pain relief medication, Tylenol, Motrin. You have a pain symptom. Instead of opioid. If you have any further question, please let box below. Atrial fibrillation or AFib. Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation when you don't have a regular heartbeat. Your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with you may be on a blood medication indefinitely for the rest of your life unless your cardiologist to normal. Okay. Sometimes people have a fib, but they don't start the because they don't have any additional risk factors such as over 75 years have high blood pressure, diabetes. Generally, if you have only atrial and you additional risk factors, then you don't have to take the blood thinner medication yet. They may put you at aspirin. So when you have a AFib, you need to select one of the oral blood thinner medication. Your AFib is very popular. You may start with the Aliquis, Yaroto, or Badaxa for your convenience. You don't have to do the frequent monitoring test like warfarin. If it is regular, then you have to take warfarin. So it is what high of your might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Protein C or protein S deficiency treatment duration. This medical condition is one of the coagulable states. When you have this medical condition, it might cause disorder or blood clot risk if of the protein S deficiency, then take a blood thinner medication for 6 to 12 months and a blood clot in like deep vein thrombosis. If you don't know the cause, then you might need to take a blood thinner medication for the rest of your life. The best medication for the indication is warfarin. Other medication like Aliquis or Yaroto, rivaroxaban, Adaxa, protein C or protein S deficiency treatment duration. If the cause of the protein C or protein S deficiency, you may need to take a blood thinner medication for 6 to 12 months. This a blood clot in your leg, deep vein thrombosis. So the cause of the blood clot, you need to take a blood thinner medication for the rest of your life. Best medication for this indication is warfarin. Other medications or ABC-band, Yaroto, rivaroxaban, Adaxa. So for this medication, I think the ongoing study anti-TT deficiency treatment duration. This is the blood clot disorder, uh, one of the hypercoagulable. If you have antithrombin deficiency, you could the cause. You might need to take the blood for 6 to 12 months. You know the cause of clot, and you might need to take a blood thinner medication for 6 to 12 months. If you have a blood clot, then you might need to take a blood thinner medication. It's basically when you have a blood clot in your leg or your lung. The best medication for this is warfarin. If you have any further questions, please let me know in the comment box below. Thank you. Factor V latent deficiency. What is factor V latent deficiency? This is a blood clot disorder of hypercoagulable states. There are of factor V latent. First one is factor V latent deficiency. This is my single risk blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication. You have a blood for your lung history, may need to take the medication such as warfarin. About months. The second type of factor V latent deficiency is heterozygous. This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take the medication indefinitely, regardless of having a blood clot in the past. The best medication for this is warfarin. They are only for the other medications such as Alaquid, Geroto, Adaxa indication. If you have questions, please let me know in the comment box below. Thank you. Antiphospholipid antibody AS or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is hypercoagulable stage. People have lupus may have the antiphospholipid antibody syndrome. Blood clot, so they may have blood clot in their leg. If antiphospholipid, antibody syndrome, or lupus, anticoagulant. You may need to take a blood thinner medication indefinitely for the rest of the blood thinner medication is warfarin or Coumadin. You should avoid taking alcohol dioxide. If you have any, in the if you have mental disease, you may need to take a blood thinner medication if you have a history and how long on thinner medication condition. Take the blood thinner medication or indefinitely. And the best medication for this condition is warfarin. If history of mitral disease and you have acute such as pulmonary embolism in your lung, you may need medication for the rest of your life or medication for it. If you have any further, let me in the comment box below. Embolism E is pulmonary embolism. It is so how long in the medication have your lung cause of a blood or the cause of the blood clot to take the medication for if that is you have a blood clot. If you don't know the cause why you have, and if that is the first time you have lung, you have to take a blood thinner medication for cyst. If you have a clot in your lung and like a lung, then you may need a blood thinner or for the rest of your life. You have a blood clot in your lung, so consider blood clot to take it indefinitely or for the rest of your life. If it's considered at for a recurrence, then you may need to take a blood maybe for the rest of or definitely. And finally, if you have a and it's related to an active, to take a blood until you no longer have cancer, 3 to 6 months. So you take the medication at least and until long active cancer. Any question about this in the comment box here. Deep vein thrombosis. What is is a blood clot in your leg? So how long you on a blood thinner medication you have a vein thrombosis or blood clot in your leg? To take a blood thinner medication 6 months it cause of the blood, and it is the first time. If you want of the blood clot, you might 6 to 12 if that is the first time. Second time of blood clot, and you may need to take a blood thinner medication indefinitely rest of your life. If the leg an active cancer, you take a blood thinner medication, you no longer have information. You need to take a blood thinner medication. You have a blood clot in your leg or deep vein thrombosis. Further question in the comment box. heart valve. If you have mechanical, you might need to take for the rest of your life or indefinitely. Let's mention mechanical valve is if you have a prosthetic OTC, you might button or you will be aspirin for the rest of your life. The general information on blood thinner medication and mitral heart valve. Follow your cardiologist, including and duration. Any further question, please let me know in the comment box. Attack or mini restriction, the adjustment after the TA, you need to take the or anticoagulation is doctor how long you have to be or warfarin. People take another 8 for some people they would have to take anticoagulant warfarin to save from attack TIA in stroke. If you haven't, please let me know. Comment. Thank you. Valve treatment, clinical aortic heart valve, a blood thinner medication in the rest of your life. The is warfarin. Aortic tissue, aortic heart valve. A blood thinner for about 3 months, and then for the rest of this nation, for how long you have to take a blood thinner, aortic cardiologist for long blood thinner medication. And have any further questions? Stroke and duration. So a stroke to take a blood thinner medication, long to be on a blood thinner. So your stroke causes such as or you have to take a blood thinner medication, or for the medication for it is warfarin. Because of embolic causes, then patient, but you take either aspirin or Plavix, or for the just go what is the best treatment therapy. So you should follow. If you have any further questions, let in the comment box below. Thank you. Cardiomyopathy. You have related cardiomyopathy and a history of fusion. To take blood thinner medication of your indefinitely. If you have dilated cardiomyopathy, left ventricular or LV thrombosis in the medication for at least 3 months, the best blood thinner medication is so you have a history of cardiomyopathy, and now you started blood clot in your leg, your lung, or you have that you may need in the medication indefinitely, or for have a myopathy and now ventricular thrombosis. Blood thinner medication, the best is warfarin. You should follow just instructions for therapy duration. If you have any, let me know in the comment box below. Prior to pacemaker or defibrillator placement, what should you do if you are taking or Badaxa? If not hold your warfarin. However, to recheck your INR prior to make sure is therapeutic. If your INR is, or make sure your doctor or the anti to hold your warfarin or a is therapeutic or at the before the, if you are taking Xarelto or Badaxa, check your kidney function. Make sure eating medication procedure. You should continue to take Xarelto or Badaxa, otherwise as indicated surgeon or proceduralist. Now concern for me, comment box below. Right for defibrillator battery change. If you are taking platinum medication, when Xarelto warfarin, you should not hold your warfarin is therapeutic. Your is elevated, then you should recheck your INA. If your INA procedure, if you have Xarelto ducts, you should check your kidney function. Unless otherwise indicated, you should follow your surgeon to listen. If you have any further question before this, let me know. Thank you. What should you do about the procedure if you have a blood thinner medication, Xarelto, or taking warfarin? You should recheck your 2 weeks prior. If you are in therapeutic and you are with your warfarin, like you have in history your warfarin for this procedure, a critical like then need to and then reduce and recheck your 1 week prior to. You have to hold more than 3 days. You should with a luminol injection to prevent current blood clot or stroke. Your doctor or breaching. If adequate or about that, you may need to check your kidney function is creatinine clearance greater than you might only need to your Badaxa or if your kidney function when you're less than 50, need to hold Alaquist more than 2 days. More than need to delay to resume Xarelto or Badaxa. You should follow your surgeon or proceduralist to resume your platinum medication. Any question, you should check with your doctor who managed your platinum medication or your anti-coag clinic. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should recheck your INA in about 2 weeks prior to the procedure. If your INA is therapeutic and your INA history is stable, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INA is critical or elevated, your doctor who manages your warfarin or your anti-coag clinic may need to hold your warfarin or reduce your warfarin dose and recheck your INA in about 1 week to make sure your INA is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then you may need to reach with your luminol injections to prevent from having recurrent blood clot or stroke. If you are taking Eliquis, Eroto, or Badaxa, you may need to check your kidney function. If the creatinine clearance less than 50, then you may need to hold your Eliquis, Eroto, Badaxa for more than 2 days prior to the procedure. If creatinine clearance greater than 50, then you only need to hold your Eliquis, Eroto, or Badaxa for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor for the anticoagulation instruction. You should resume your blood thinner medication as instructed by your surgeon or procedure list. If you have any further questions, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Eroto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4-5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to reach with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency. If you are taking the lobanol injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulation instruction closely. Make sure you understand when you need to start the lobanol injection, when you need to stop the lobanol injection before surgery, when you need to resume after the surgery, and when you need to completely stop the lobanol injection therapy. If you are taking Eliquis, Eroto, or Badaxa, you should check your kidney labs, make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Yeroto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manage your warfarin, your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badab. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have elevated or critical iron, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range before you can plan procedure. So you should follow your doctor who manage your warfarin or anticoagulant closely to you have a appropriate plan for surgery. You have to hold your warfarin more than 3 days. Recommend that you should consider with the Lovenox injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as factor 5 deficiency or some kind of genetic. If you have to risk with the Lovenox injection, you need to follow your doctor or closely to make sure you understand when you need to start Lovenox injection, when to stop Lovenox injection for the surgery, and when to resume your Lovenox injection after the procedure. When completely stop the Lovenox injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more update labs than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, for example, if
less than 50, then you may need to hold more than 2 days. You should resume your Alaquix the day after the procedure if your kidney function is normal. You should delay resuming your Alaquix, Geroto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should also check with your surgeon or proceduralist. Make sure you are safe to resume your blood thinner medication. If any difference, you need to talk to your doctor who manages your blood thinner medication or your anticoagulation. If you have any question, concern, please let me know in the comment box below. Thank you. Liver biopsy. What to do prior to liver biopsy procedure if you are taking medication such as warfarin, Eliquix, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manages your warfarin for the end. You have a procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take the lobanol injection, you need to follow your doctor who manages your warfarin or the anticoag instructions closely. Make sure you understand when you need to the lobanol injection, when you need to stop the lobanol injection right before the procedure, when you need to resume your lobanol injection after the procedure, when you need to completely stop the lobanol injection therapy. If you are taking Eliquix or Geroto or Badaxa, you should check your kidney labs to make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Alaquis Gelato or Madaxa more than 3 days. And you may need about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Alaquis Gelato Madaxa in procedure the day after the procedure. If your function is not normal, endurance less than 50, then you might delay your Alaquis Gelato or Madaxa. You should also check with the surgeon or proceduralist when it's safe to resume the platinum medication. If any different, you should let your doctor who manage your warfarin or platinum medication or the anticoagulation so they can update the recommendation. If you have a question for the liver biopsy procedure, if you have or other platinum medication, let me know in below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a platinum medication, check warfarin, Alaquis, Gelato, or Madaxa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If you are critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you consider reaching with the lobanal injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobanal injection, you should follow the doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start the lobanal injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobanal injection quickly. If you are taking the Alaquis, Gelato, or Madaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum medication. If any different, you should check your doctor who manage your platinum medication for the anticoagulant. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Yeroto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold your warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hope for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider switching with the lobenol injection if you have a recurrent blood clot or stroke history and you have strong risk factor of having blood clot or stroke, then you need to put with lobenol injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the lobenol bridging. You should follow the instruction closely to understand when you need to start the lobenol injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the lobenol injection quickly. If you are taking the Eliquis, Yeroto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you may need to hold more than 2 days, and you may need to delay resuming your Eliquis, Yeroto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, you need to discuss with your doctor who manage for platinum medication or anticoagulation. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan bridge with the lower node injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower node injection, you should follow the instruction from your doctor who managed your warfarin or the anticoagulant to make sure you understand when to start the lower node injection, when you need to stop for the procedure, when you should resume your lower node injection. If you are taking the Eliquis, Xarelto, or Adaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Adaxa more than 2 days. If you have normal kidney function, then you might need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who managed your platinum medication or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Xerotol, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manage your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Xerotol, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to procedure. If stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR. Come back in 1 week to see if your INR improve, or you can plan surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week, make sure your INR improve, so you can plan for it. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need a bridge with the lower nerve infection. Your doctor who manage your platinum medication, warfarin, the anticoagulant, will give you a separate instruction. Make sure you understand when you should start the lower nerve injection, when you need to stop right before procedure, when you need to resume after the. You should follow the instruction closely. If you are taking Eliquis, Xerotol, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you resume 1 day, 2 or 3 days, depend on your kidney You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with, with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improve, or you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a lobenal injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to proceed with the lobenal injection, it should give you a separate instruction when you need to start your lobenals, when you stop before the procedure, when you should resume your lobenals after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So, your doctors who manage you, Eliquis, Xarelto, or Badaxa, or the anticoagulation will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Badaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the low-enough injection, then your doctor who manages your warfarin or anticoagulation, they will instruct you how to start your low-enough injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manages your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. Your doctor who manages your platinum medication or your anticoagulant will give you complete instruction when to stop, to resume Eliquis, Xarelto, or Badaxa. based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume for platinum medication, you need to discuss that with your doctor, manage your platinum medication or your anticoagulation. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking platinum medication or when you're taking platinum medication? Do not hold your platinum medication unless otherwise as instructed. For warfarin, you should test for INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR is not therapeutic, then you may need to restart the cycle. If you take Eliquis, Xarelto, Pradaxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, you should report to the proceduralist or the anticoagulation. Cardioversion. What to do prior to cardioversion procedure if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Pradaxa. Typically, you must be on platinum medication before they came to cardioversion procedure. And do not hold your platinum medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If you are not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, your INR is supposed to be therapeutic. If not, if your INR too low, they may need to reach you with a Lebanon injection. For the Eliquis, Xarelto, or Pradaxa, you have to continue taking this medication. If you miss any dose, you need to report to the proceduralist or your anticoagulation or the doctor who made the warfarin or platinum medication. So generally, you should not hold your platinum medication before and after the cardioversion, or with after. If you miss any dose, you should let your doctor know. The surgeon or proceduralist or the anticoagulation, so they had to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other platinum medication, Eliquis, Xarelto, or Badaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa? Cardiac cath is the serious surgery, so um, if you take warfarin and you are stable with your INA history, or if you or if your INA history is stable for a long time, then you should recheck your INA about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You may need to be bridged with a lobanal injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with Lovenox injection, and you need to follow your doctor who managed your warfarin or the anticoagulation. Make sure you understand when to start the Lovenox injection and when to stop right before the procedure, and when you can resume the Lovenox injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis, Xarelto, Badaxa patient, they might need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac cath surgery. If they have unstable kidney function or chronic kidney disease, and their creatinine clearance less than 50, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to resume in the Eliquis, Xarelto, or Badaxa. So the doctor who managed your Eliquis, Xarelto, or Badaxa, or the anticoagulant will give you specific direction or instruction when to hold your Eliquis, Xarelto, or Badaxa, and when to resume. but you should check with your surgeon or procedure list to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or procedure list may delay to resume your blood thinner medication. Please let me know if you have any question in the comment box below. Thank you. Hello. What should you do prior to colonoscopy procedure if you are taking blood thinner medication, such as warfarin, Aliquid, Xarelto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then should hold your warfarin for 4 to 5 days prior to the procedure. You might need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose to the therapeutic before you can plan for the procedure. If your INR is slightly high, then and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor your doctor who manage your warfarin for the anticoagulation. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Aliquid, Xarelto, or Badaxa, you probably need to check your if not within 3 months. Your Aliquid might need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin excuse me, then you need to hold your Eliquis, Xarelto, or Bedexa more than 2 days. When you need to hold your Eliquis, Xarelto, or Bedexa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Eliquis, Xarelto, or Bedexa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis, Xarelto, or Bedexa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulation and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis, Xarelto, or Bedexa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who manage your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. What should you do right? The dental caps to hold your blood thinner medication prior to the dental cap procedure. That's right, actually, by your doctor who manages your blood thinner medication or anticoagulant. If you are taking warfarin and you don't have a stable NR history and you have a critical INR recently, and you might need to check your INR prior to and unless your dental oral surgeon know that you have critical INR recently. If you have any active bleeding, you know to make sure everything's safe. They don't do it now, it's not the dental caps. And if they want you to hold to a warfarin prior to this procedure, then you probably need to discuss with your doctor for blood thinner medication or the anticoagulant for recommendation. If you have to hold your warfarin, hold for doctor anticoagulant. If you have to hold your Eliquis, Xarelto, or Bedexa, then may need 1 day prior needed. Again, you need to discuss for doctor any recommendation. Or if you have to hold your warfarin or Eliquis, Xarelto, or Bedexa, you need to check dental see when you letting them. If they don't have any instruction, no idea when you need to, then you need to consult with your doctor, manage your platinum medication or your hypoxia for the instruction. Have no active that you resume platinum medication same day, day after the right. So prior to a dental caps procedure, you don't have to hold platinum medication unless otherwise it's instructed. Check your INI if needed. Critical INI recently or INI history not stable. You have active. You should let your dental, your healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that or letting the medication. Okay, if you have any further question, concern, please let know in for the dental cleaning procedure. What you need to do prior to dental cleaning procedure, if you are taking platinum medication like warfarin, Aliquid, Boto, Padaxa, so I would recommend that you should not hold platinum medication for routine dental cleaning. If your if you're taking warfarin, you need to make sure you are stable with your iron level. You don't have critical iron before routine cleaning. If you have critical iron, probably you need to hold your warfarin for a few days in order to get your iron to the therapeutic level. So avoid your routine cleaning if you just have the critical iron like over 5 or your iron over 6, or you have any active bleeding with over or platinum medication. For the deep cleaning, if you have to have a deep cleaning in, on the platinum medication, consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. They have to review your iron history, and then they will give you some recommendation based on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. If your iron, if your iron is not stable and has the history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Aliquid, Yeroto, Abadaxa, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day prior to deep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they don't recommend you have to hold your platinum medication, then you should not hold your platinum medication you don't have any concern about bleeding, if you are stable with your warfarin doses, and then you have a good history of your INR therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then your doctor who manage warfarin have you to resume your warfarin after the procedure. But you need to double check you are safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you are taking the blood thinner medication, please let me know in the comment below. Thank you. Bye. Hey, prior to a dental grounds procedure, what should you do if you are on blood thinner medication? If warfarin, Eliquis, Geroto, Badaxa, I would recommend should not hold any blood thinner medication prior to this procedure. Otherwise, as instructed by your doctor who manage your warfarin or blood thinner medication or typhoid. You should check your INR warfarin if you have a critical INR recently, if your INR history not stable, you have active bleeding like blood in urine, stool, cough up with blood, stomach bleeding, things like that, then you need to let your dental know that you have some concern with your bleeding. And then you might need to make sure your INR not too high prior to avoid any major bleeding. Sometimes your dental might want to add this additional procedure, then will cause a problem if they're not aware of critical INR or active bleeding. That if they want you to hold your warfarin prior to dental grounds procedure, and you need to discuss with your doctor who manage your warfarin or other blood thinner medication, or you need to discuss with anticoagulation, sure you have the instruction there. And then if they want you to hold your Eliquis, Geroto, or Badaxa prior to the procedure, for this procedure you may need to only hold the blood thinner medication for a day prior to the. Again, you need to talk to your doctor who manage your Eliquis, Geroto, or Badaxa, or talk to your anticoagulant for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, and you need to discuss with your the medication or the anticoagulant. Um, Generally, if you have bleeding after the procedure, right, resume the platinum medication on the same day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. Prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquis, or Xarelto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any platinum medication. But I would recommend test your eye now prior to the procedure if you are not stable. If you are not, you have a lot of eye now out range, especially higher your upper range. You should check your eye now prior to avoid bleeding. If you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want iron between 2 and 3, or they want iron less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your iron expect to be at certain level prior to the procedure. Usually, they want your iron on the day or within 24 hours prior to the procedure. So if depend if you are in excuse me, if you are in not stable or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get to achieve the iron goal within 24 hours. So, for example, if your iron like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1 days prior to the procedure, and then you need to detach the iron the day of procedure. So to make sure you are in at 2.3, 2 to 3, that what your dentist want. If your dentist want your iron less than 2 prior to the procedure, then you might need to hold for 3 days. If your iron for 3.5, 2 weeks prior to the procedure, and you hold like 3 days prior to the procedure to make sure you are not less than 2. So it still depends on what your dentist want or expect you are not level or low before the procedure. If you have to hold your iron, hold your warfarin for 5 days prior to the procedure, okay? Sometimes they have difficult or multiple tooth extraction. They may want you to hold for 5 days prior to the procedure. They want the iron level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure you don't have any help needed. So if you have to hold your warfarin for 5 days to get the iron at less than 1.5, then you may need to be breached with the lower knob injection or inoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to breach with the lower knob injection, then there is instruction, when to start the lower knob and when to resume lower knob injection. You have to follow the doctor who manage the doctor who manage your warfarin. If you take Eliquid, Yeroto, or Badaxa, it's easier to manage prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquid, Yeroto, or Badaxa, but for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe. It's safe for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Eliquid, Yeroto, Badaxa, then resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a single extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold the warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure safe from blood clot or stroke. And if you take an Eliquid, Yeroto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be breached with lower knob injection, then you have to follow your doctor who manage your warfarin to make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, or Bedaxa? You don't have to hold your platinum medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who managed your warfarin or your anticoagulation or your dental or your oral surgeon. Okay. If you have a unstable, you have an unstable INR history, then you may consider if you have a critical INR recently, then you should check INR, make sure your INR is not too high, right? The procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do. They need to postpone the procedure, this procedure, because you have bleeding, you are not too high. But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold the warfarin, and you need to follow your doctor who managed the platinum medication or the anticoagulation. And if they require you, if you're taking the Eliquis, Xarelto, or Bedaxa, and they require you to hold your platinum medication, okay, prior to the procedure, you have to hold. And if you have to hold your platinum medication, then you resume your platinum medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who managed your platinum medication or the anticoagulant, when you should resume platinum medication. If you don't have any higher bleeding after the procedure, then might resume the platinum medication the day after the, or even 10 day of the procedure, you have no bleeding done. All right, so again, before a dental fillings procedure, you don't have to hold any platinum medication. That's otherwise as instructed. And then you don't have any stable INR history, critical INR recently, then check your INR the bleeding risk procedure. And for the fillings, you should not worry about INR history bleeding, but they have live platinum bleeding. Probably do anything at the hospital eye. They have also patient push the bleeding back to normal. All right. If you have any further question or concern, write to a dental. Please let me know in the comment. Thank you. Before a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, Bedaxa? I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have your uh, recent INR was critical, too high, then you should check your INR prior to the procedure to make sure you are safe from the procedure. Um, if your INR is therapeutic or you have history of stable INR, good INR history, then you don't have to hold your warfarin right to, unless otherwise as instructed by your um, doctor who manage your warfarin or the anticoagulant. Or if your dental or your oral surgeon recommend that you hold your platinum medication, then you need to discuss with your um, doctor who manage your warfarin or the anticoagulant to make sure that you hold the platinum medication appropriately. So if you have unstable INR history or your INR was critical recently, you should check your INR, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulant clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your liquid, your total Bedaxa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the INR level they want before a procedure. And then if you require to hold your Eliquis, Xarelto, or Bedaxa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Xarelto, or Bedaxa, then you need to resume your platinum medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manage your warfarin or your anticoagulant to see if they have it. And if you have any further question or concern prior to a dental root canal procedure, please let me know in the comment below. Prior to dental scaling procedure, so what should you do when you are taking a platinum medication, that warfarin, Eliquis, Xarelto, Bedaxa? I would recommend you should not hold platinum medication otherwise as instructed by your doctor who manage your warfarin or your clinic who manage your warfarin. or your anti-clinic who manage Aliquis, Geronto, or Badaxa. If you are taking warfarin and you have unstable iron history, then you need to check your INR to make sure you are not critical prior to a procedure. So if you have a critical INR, you should hold your warfarin until your INR back to the therapeutic level or below range be safe for the procedure. If you are stable with your warfarin and you have a good INR history by in range for a long time, then you may not hold your platinum your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your platinum medication prior to dental scaling. If you have to hold your platinum medication prior to the procedure, as instructed by your dental, then you need to resume your platinum medication instructed. Make sure have a bleeding can control your blood clot, prevent stroke if you don't. Now, you take too long to boom. So that's the only way you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on platinum medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anticoag clinics, make sure they have a recommendation, safe procedure. Again, I would not recommend take platinum medication before a dental scaling procedure unless otherwise as instructed by your dental. If you are not stable with your warfarin doses, you have unstable INR history, and have the critical INR recently, and you should talk to your doctor or your anticoag clinic. Make sure that they give you good instruction what to do with your platinum medication prior to. And then after the procedure, you resume the platinum medication as instructed by your dental. You don't have any instruction if they don't know what to recommend, then you should follow the doctor or your anticoag clinic recommendation. Safe. Resume the platinum medication appropriately. If you have any further question or concern about before dental scaling procedure, what you do, and you are platinum medication. Thank you. Prior to a total knee replacement surgery, so what should you do if you are on platinum medication? if you are taking warfarin, then your doctor who manage your warfarin or the formulary clinic, they might reject your INR about 2 weeks prior to the procedure. Depending your INR result or your INR history, then if it's too high, then they adjust your warfarin dose, then have you to back in 1 week. And then if you are getting back or get into the range, then they may hold for open for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or recurrent stroke, then they might need to bridge you with the low injection. And so when they have to push you with the low injection, they need to make sure you have up 2 days kidney labs, within 3 months of your kidney lab, and then your current weight in order to dose Lovenox. There are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or like make sure you take you breach the Lovenox injection correctly. And then if you take Aliquid, Gerotobadexa, your doctor who manage your blood thinner medication or the anticoagulation might check your kidney function. They need to update the labs needed, usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you should need to hold for like 2 days prior to your total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your PA screening clearance, and they recommend that you might need to go more than 2 days. So if you have bad kidney function, then you might go 3 days off again on your. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Gerotobadexa days or more, then you need to check with your surgeon or the proceduralist your blood thinner medication. Generally, for warfarin, you may resume your warfarin the day after procedure if okay with surgeon. And then for the Aliquid, Gerotobadexa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid, Gerotobadexa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulation who manage your blood thinner medication and your surgeon or a proceduralist. Have any further questions or concerns? Let me know in those.
Hello, Yangting. This is a very good question. A lot of people ask me this I don't manage the comedy clinic. Yes, people have to take both warfarin and aspirin, but not a lot of people. Some people take both warfarin and aspirin. Aspirin generally take for the platelet or certain people, certain patients have the AFib, but have additional factors. They need to take aspirin, but when they have additional factors like over over 75 or have diabetes. So generally the jet tubes are over 2. They should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year also. Some people have to take the other end of like plastics. So depending on your medical history or your pharmacist will reveal whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further question? Please let me know. Thank you. I am Tim. This is another good question. I think generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days. But you need to check with they are okay for. Hello, Yati. This is a good question. What is the difference between Motrin and Tylenol? I say Motrin is a non-formulary steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. whereas Tylenol is used for non-inflammatory in like my headache or my fever or my back pain. Just pay attention on the side effect for each of these medications so you probably. So, Motrin may affect your stomach like ulceration when you use very high dose or you take it in empty stomach. So, and then it might affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. And Tylenol may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally 500 to 1,000 every 4 to 6 hours. Not see 4,000 milligrams a day may affect your liver. Especially if you have any liver disease, you should consider heavily when you take in Tylenol. And when drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. For those, this is very important to consider when you should take Tylenol or Motrin. That's pretty much, what's different between Tylenol and Motrin. If you have any further questions, please comment below. Let me. Thank you. Hi, friend. It's a good question. Basically, this is a general question I used to have. Typically, as you know, we should not take Motrin while we are on warfarin because Motrin is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin or Eliquis, Yeroto, any type of anticoagulant, take Motrin. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Motrin.
All right, so next medication is warfarin. So when you should not take warfarin. You should not take warfarin if not recommended by your doctor or pharmacist. Okay. If there is no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, fibrillation, or AFib, this is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. Did not start warfarin if you have active or significant or major bleeding. You should discuss with your doctor or your pharmacist to make sure they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you ask your doctor and your pharmacist. You have active bleeding or you have a history of major bleeding. Warfarin. And if you have been taking warfarin and you should have the active bleeding, that you need to report to the doctor. They stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Aliquid, Xarelto, Adaxa. They blood thinner medication, you should complicated medication. If you are about switching from warfarin to Aliquid or switching from the other blood thinner medication to warfarin, then there may be some overlap for a few days. For example, if you switch from Aliquid warfarin, then you need to overlap the Aliquid and warfarin for 3 days, or you stop the Aliquid. Make sure warfarin start working in your body after 3 days, like that, but not taken together in a daily basis. So your prevent your blood flow. And when you on warfarin, or you are new to warfarin, and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the antiplatelet like Plavix or aspirin. You need to check to make sure you still need to take Plavix or aspirin. And if you have been taking warfarin, then they just start a Plavix or aspirin, then you need to let them know you're on warfarin. Make sure the Plavix or aspirin they want to start, you need it. Sometimes it's not. Sometimes they don't know if you are on warfarin. Let's just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin. You should check with to make sure you don't have to take the medication that not take. Even beside. You should not take warfarin if you're allergic to it. And then one more thing for the warfarin. So typically you should hold 4 to 5 days prior to the major surgery or procedure, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that, presume that your INA level is at the therapeutic level. And if your INA level, at the supra-therapeutic or out range, then we'll have hold your INA, hold your warfarin accordingly. Because that is different topic, very complicated. And then, after the procedure, then you ask the surgeon or the proceduralist, make sure that if it's okay to resume the warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who will perform the procedure, make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room, just bleeding, patient. And when you taking the warfarin, then what medication you should avoid. Check with your doctor or pharmacist. Every time you have a new medication, including over-the-counter herbals, vitamins, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both affect warfarin and affect your body. You check with your doctor and when you have any kind of bleeding, you need to report to the doctor, or even you just have abnormal bruising, check with your doctor. You might have too much warfarin in your body, or you might have sick or eat any food that increase INA or increase bleeding. Just make sure you report it. And pay attention, and sometimes they switch you to a new platinum medication, Aliquix, Geronto, then I need to stop warfarin. When you start the new platinum medication, like Aliquix. Make sure that you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or after warfarin. Have any further question or want to clarify anything? Please let me know. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But, yes, you can do that, but if you don't have any additional medical condition, or if don't know how much you should take, things like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, your liver. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your family, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, blood thinner medication like warfarin or Aliquid, but that's it's okay for you to take Tylenol. It's safe to take compared to all the pain. And so, and then the last one is you should not take Tylenol if you are allergic to it. So, be very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right, so the next medication is fish oil, omega-3. So the omega-3 or fish oil you can buy over the counter, and it's generally safe to take, but I would recommend that you should check with your doctor to make sure you take it correctly. Okay? And I would not recommend that you should take the fish oil if it being expired. You should make sure that it's not expired, so you take the good product. If it's expired, it may cause problems. When it's expired, it's no longer effective like it should, but it increase side effect, like bleeding or cramps, nausea, things like that. The main side effect or that taste, that smell. It might contain harmful bacteria. When it's expired, it may leaking or broken. You may experience some bacteria.
And some research indicate that it may lead to increased risk of cancer. Expire. Make sure you check the expiration day and take it correctly. Also, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or if you have after you take fish oil, you have bleeding or you have any kind of dark or hairy stool, then you may need to stop taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous. When you take fish oil, it increase risk of bleeding. And you should not take the fish oil to taking other blood thinner medication like Aliquid, Eroto, Alexa, or the antiplatelet like aspirin or have bleeding or low hemoglobin. Those factors very important to consider whether or not you should continue taking fish oil or start the fish oil. If you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligrams a day without clear indication. Now, if somebody have some sort of increased cholesterol, then they might take about 2,000 milligrams a day. But if you take more than that and you don't have any clear indication, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 grams of fish oil a day. And do not take fish oil if you're allergic to it. Okay? It is very important information, and not about it. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I would recommend you should check with your doctor and your pharmacist if you have any active bleeding or if you blood thinner medication you are safe from bleeding. And you should not take this medication when it is being expired. And then when you your iron is very high, like critical level or elevated, just stop taking this oil, or do not start or eat supplement or water cup. All right, if you have any question about this over the counters, this medication, please
let me know your comment. Thank you. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or or a general pain. But, yes, you can do that, but if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, the liver. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your family, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, blood thinner medication like warfarin or Aliquid, but Adaxa, it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. Okay, so and then the last one is you should not take Tylenol if you're allergic to it. So the very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the next medication, Motrin. This is also available over the counters at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter, or can get prescription from your doctor. But you should not take Motrin or ibuprofen if it's not recommended by your doctor or pharmacist. And you should not take the Motrin if you are on empty stomach. You don't have any food in stomach. Might cause problem, stomach ulceration, or bleeding. So make sure you eat
before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So major stomach problem like peptic ulcer or gastric problems, or heartburn, or GI bleeding or stomach bleeding, blood in urine, or kidney problems. You have the kidney dysfunction or renal problems. You need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. Okay, so if you are taking warfarin, blood thinner medication like warfarin, Eliquis, Xarelto, or Badaxa, etc., you should not start the Motrin or ibuprofen. If you have, headache or back pain or toothache, things like that, you might try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Eliquis or any blood thinner medication. So, and if you taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you a new blood thinner medication like warfarin or Eliquis or Badaxa. You should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. If you take more than that, it might cause very serious side effects like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take Motrin or ibuprofen if you're allergic to it. This very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen, pay attention to this information. Very, very important. If you don't follow the recommendation from your doctor or pharmacist, you may have problem with medication. Most of people have stomach ulceration that they didn't take the medication correctly. They take on their empty stomach. That easily cause stomach ulceration, and it may damage your kidney. You take too much Motrin, like overdose of, or more than 4,000 milligrams a day, and you may have some kind of bleeding, maybe gastric bleeding, when you take with warfarin or Eliquis or any other blood thinner medication. All right, so this excuse me, this is very important information. I hope that you should pay attention to this information before you start or stop the medication. The Motrin you may take as needed. You don't have to take it every day. Just take it as needed for your pain. And this is the non-formulary steroid medication. The non-steroid inflammatory medication, NSAID, they call NSAID. Usually, the Motrin, they take something
or your swelling pain. When you get your toothache and you have swelling gum, or you have back pain because the swelling or inflammation of your back, muscle strength, things like that, open may help a lot compared to, I don't know, if you are taking a blood thinner medication, then avoid open, increase bleeding, and it may affect your kidney function. All right, thank you. So do not take aspirin if the one not recommended by your doctor or pharmacist. So for this medication, it has some serious side effects. So you should not take it if it's not recommended by your doctor. Number two, if there is no clear indication, for example, the clear indication including, take aspirin for your heart, for your atrial fibrillation, or for stent, protect the blood clot due to stent insertion. Excuse me. So I would recommend that you should check to see if you have any clear indication for your expert. Number three, do not take aspirin if you have any active bleeding, like GI bleed or stomach bleed, nose bleed, or blood in the urine. So any active bleeding should you may need to hold your aspirin. And of course, talk to your doctor or your pharmacist if they have any further recommendation. If you are taking anticoagulant like warfarin, Aliquid, or Xarelto, you need to make sure that if you have to take the aspirin, usually the baby aspirin, while you're on the warfarin or Aliquid or any type of anticoagulant, or even the antiplatelet like Plavix. So these medications have the coagulation effect. So make sure you check with your doctor or pharmacist to make sure if you are required to take aspirin while you're on a blood thinner medication or not. Or if you are taking the baby aspirin or the regular dose aspirin, the 325 milligram aspirin, then you need to talk to the doctor who give you a new blood thinner medication, like warfarin or Aliquid. Talk to them to see if you have to continue the aspirin while they start you blood thinner medication open. And do not take aspirin if you're allergic to it. May have some kind of that reaction. It's very dangerous. Aspirin. So these are very important information for you as a patient to know that while why you should not take the aspirin or why you should not continue to take aspirin when you have a new medication such as new blood thinner medication like warfarin, Eliquis, or Bedaxa, or Plavix. All right, so any question, concern about this topic, please let me know. Thank you. So the last part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say a C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So today's applying, so no law talking about the quantity maybe dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 months supply, but like I say, most insurance companies limit for 90-day supply for prescription only medication. And then some medication, it's very dangerous to spend over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum, like medication like a Seroquel or Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medications, they might not give you more than 90-day supply. That is the basic safety, not about insurance, not about the money. That is the safety. Most of the pharmacists or the doctor, they don't feel comfortable, they're not comfortable to dispense more than 90. For the refill, there's no specific set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial fill is permitted, however, the total amount or quantity in all partial fillings must not exceed the total amounts prescribed for a prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days were issued from many insurance company and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid.
of insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. But the old pharmacy cannot transfer your expired prescription, to a new pharmacy. But this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the date of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, they, like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes, high cholesterol, those disease, those medical conditions, a chronic medical condition require you to take for a long time, then you might request 90-day supply for your convenience. Then most of the pharmacists accept that request from you. You don't have to ask your doctor for that, and ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication they require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the psycho problems, and you need to see the psychiatrist before you get the prescription renewed. Or some medication required to monitor your blood, like Coumadin, to get the lab blood test draw before they can renew your prescription. And like that, you need to work with your doctor. The pharmacy cannot help you with those things. And within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy to get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. From C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain the pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy do your medication, why sometimes they don't. They will do your prescription. Thank you. Have a good one. I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions or C5 prescriptions. Again, you need to understand the day supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying, how many they supply. I need anything, any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C3 and C prescription. It's limited to 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want to set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture fill. So there is no law regulating fracture fill or C5 prescription. But the total amount of all fracture filling, but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 prescription, C3 and C4 prescriptions, then the prescription may be just valid for up to 6 months from the day it was issued. So it still depends on your states. Okay. But if your state had no specific or set time for expiration, then the prescription might be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient. Understand, why they give you certain day supply, and usually for those states who have no regulation on the C5 prescription, then they might fill up to 90 day supply. It's just like regular prescription medication due to 90 day supply. But if it consider C5 prescription as the C3 and C4, then it may only give you 30 day supply. And again, check your state regulation to see if you can refill the prescription beyond 6 month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. You let me know if the Schedule 5 controlled substances prescription or C5 prescription. Thank you. There you go. Schedule 3 and 4 prescription. So again, the day supply or state law, some state law is the maximum 30 day supply per single filling, or be spent at one time. Federal law say maximum 34 days supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the 3. Make sure you know the time limit, and only fill 30 days supply or 34 day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34 days supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of 4 times 6 months is equal to 24. Probably you have
or refills if 30-40 supply. For box refill, yeah, if the pharmacy is unable to supply the required quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. This C2 prescription, the patient cannot request a box refill. Okay, and then the state law, you might not exceed 30 days supply, and the total quantity in all box refillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a box refill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So this really basis but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier. If the patient want to get the prescription too early, they only do 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then some a lot of patients, they don't understand this why the pharmacist refill to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining. And the pharmacist, the healthcare insurance may have some information. For example, if you fill the prescription multiple pharmacy, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right, if you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. Good Friday, everyone. I would like to talk about pharmacy law today. A lot of patients and some pharmacists confused about pharmacy law every day, especially retail pharmacists. and people who work at the chain pharmacy like CVS, Walgreens, Walmart, um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, hydrocodone, morphine, those medications controlled substance Schedule 2 or C2 prescription. So first I would like to discuss about day supply. Okay. So excuse me. So the day supply of C2 prescription, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication can be 60 days supply. And some injectable infusion medication during the bumps, they may be okay for 90 days supply. So for these day supply limit is a different and vary state to state. So you may need to check with your state law to see what are the supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial filled because they don't have enough medication in stock. So they are out of stock medication. And in that case, the pharmacist might give you some partial fill. But it's very complicated to do the partial fill. Pharmacists need to spend the rest within 72 hours. And if after 72 hours, the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the partial fill. And then it's not permitted the patient request, so the patient cannot request a partial fill. The partial fill only occur if the pharmacy does not have enough medication in stock. So how long the Schedule 2 prescription is valid? Depend on state. Some state uh, it set the time limit like 30 days limit. After 30 days, the prescription is no longer valid. So um, you may need to get a new prescription for C2 medication if you cannot fill the medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient or, patient with a diagnosis of terminal illness, the prescription may be valid up to 60 days from the day of issuance. So, um, for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of production fill. If you don't get the production fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. And then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bumps, the medication for infusion, then you need to make sure you fill the medication within the time limits. All right, if you have any questions, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So, Schedule 3 and 4 prescription.
Hello. This is a very good question. Lots of people taking fish oil nowadays for their cholesterol and other medical conditions such as arthritis, inflammation, or their heart. So there are some drug interaction between fish oil and oil. Some people may experience more bleeding or bruising when taking fish oil and oil. So if you have any abnormal bleeding or bruising, you should report to your doctor. Anyway, before starting fish oil or any over-the-counters or herbals, you should check the doctor who managed your warfarin to make sure he or she aware of new medication or that may increase risk of bleeding when we are on platinum medication, such as warfarin. And I think fish oil may not affect other oral medications such as Alaplex or Eropa.